where did your passion come from this, and what's your why?
Yeah, so my passion for maternal child health came from many experiences of loved ones in my family and friends. And then recently from my own experience, I was premature and I didn't really understand that what that was like until I had my own baby. And my mom would always tell me what I call my preemie story every birthday. I mean, just think about it. Like she would, tell me I was a preemie baby and she would cry, I didn't know if you were going to make it, but God kept you here, and tell me about the hospital visits that she had to make and drive, from a rural area all the way, like 40 miles just to come and visit me during visiting hours. And things were so different then too. And the doctor said I wasn't supposed to survive. And it wasn't until I had my own baby. Of course I cared, and she shared this, and it was just so moving to me, and who wants to see their mom cry? But I didn't get it until I was in that same position with Zoe, and she was there in the hospital with me, and we were holding hands, and she was the one person I knew totally got it. And we didn't have to speak. We just hold hands, and I knew that she understood. She inspires me, and that is part of my why, coupled with my own experiences as well. So just really my passion for our community, our passion for healthy moms and healthy babies, and just my passion for, all things that are equal and just, and it's not being able to sit by and watch and see injustices unfold.
Yeah, well, that's so touching, and definitely almost had me crying. But I never knew. I don't think I knew that you were a preemie. So thank you for sharing that story. It's definitely really beautiful. Like you said, to have someone, your mother. I know it's not what you all would have wanted to be in that situation, but to have her there, be there with you, and to be able to support you, her miracle. Praying for your miracle, and thank God that you both received that miracle, of having that baby, and so your baby to live, I should say. And then tell us about some of the advocacy work that you've done in the community already.
Sure. I mean, I can start with this session. Super excited. It's over for one thing. I do love it, but it's a very intense 60 days. So no matter how much you love it, everybody needs a little break. And just really the wins are just very inspiring. And the losses sometimes feel like defeat. When you're super passionate about something, you're just like, why don't they get this? Like, or they get it, but why are they pretending like they don't get it? Right. Why, like, just admit you want to maintain the status quo and let's just be done with it, right? So those things are very frustrating when there's obvious things that need to happen in our community, and the powers that be are upholding systems that are very oppressive that you see need to be changed. And it's very frustrating. So some of the advocacy that I engaged in alongside some really amazing people on some very powerful, just inspiring coalitions. So let me say, it's not like a one person show. There are teams of people working on all levels. And it's just amazing to be in that space, in that community of people who want change. It's just that in itself is uplifting. So one of several key things I'm super excited about, and we've talked about this too, there was some mental health and there were some mental health instruments that were authored by Representative Royce DePlessis that address maternal mental health. Really exciting because our coalition worked directly with him to create that legislation that will definitely have a lasting impact on moms and birthing people in our state, and hopefully inspire or be a catalyst for long-term change. One of those was HCR 103, which was an urgent request for moms to be screened for perinatal mood disorders during pregnancy, after pregnancy, during the child well visits. And we know that that's not happening consistently now. Now, granted, it's a resolution, so it's an urgent request. It's not a mandate, but it does create a sense of urgency, but a heightened level of awareness of this issue that's not happening. And in order to get treatment for people, you got to be screened. So that was huge for us. And then HCR 105, the other one was 103. I hope I said that, but 105 is actually the creation of a maternal mental health task force, which is a multidisciplinary group of agencies that are charged with examining the maternal mental health needs of our state, the barriers to access, treatment deficiencies, racial disparities. And this group will meet for about a year, and they will publish a white paper with the findings, with policy recommendations to overcome those barriers. And I'm just really excited about that. Representative Duplessis has emerged as a champion for mental health and maternal mental health. And he was very, very supportive of this, very interested in championing this, and he did. So we're ready to get to work. Well, I'm not like on the task force, but several of my clients are. So when I say we, I mean it in that context. We're ready to get to work so that for 2021, Representative Duplessis, and I'm sure many of his colleagues who are passionate about mental health, will then take those policy recommendations and actually file legislation on 2021. So that in itself is exciting. So we get a little break and then we gotta get back, right? And then State Representative Matt Willard out of New Orleans too, he is a champion for maternal and mental health and ending health disparities as well. He authored House Bill 190, which addressed some deficiencies in midwifery care, some payment reform issues associated with midwifery care, and payment discrimination with insurance companies, coverage issues, and then also took us one step closer to creating insurance, having insurance cover doula service. This is to make sure that a service is as critical as having a pregnancy coach by way of a doula is accessible to as many people as possible. Some insurers cover it, some don't. So Representative Willard bill established the Louisiana Doula Registry Board, which is a body led by doulas to create some infrastructure in terms of setting up some, infrastructure in terms of what payment reimbursement looks like through public and private insurance, so that in the upcoming session, or if there's some activity that happens in between with each individual insurance company, we are one step closer to having doulas covered through private insurance, and hopefully one day Medicaid as well. In every state that was able to have doula coverage provided by insurance, all but one, and it's only like about 5 or 6 so far that have done this, they had to establish doula registry boards. So we were really excited about that. And that's just one step closer to making sure that people can afford this type of service to help them have better pregnancy and postpartum outcomes. So there were several other bills. There was the removal of the pink tax on feminine hygiene products and diapers. That was a bill that was just several years progressing, and several others. So we had a really good session. And then another bill that several of my clients worked on in the Pregnant Worker Fairness Coalition, or the Southern Justice Coalition, was Senate Bill 215. And that bill was about two or so years in the making, 2.5 or so years in the making. That would ensure that employers have to provide reasonable accommodations to pregnant and postpartum workers, because what we were seeing, nationally, is that pregnant women, women and birthing people were not being afforded basic things like certain breaks if they needed them, a stool to sit on, to be able to drink water at their station if they needed it. And there were people that I know of that complained about the insensitivity on their job, and feeling as though they were trying to be pushed out. And people shouldn't have to choose between their health and having their basic needs met with the job. So this bill basically provided extra protections for workers, and a bit more specificity in providing services to them to make sure they could not be pushed out of their jobs and they were accommodated for their individual needs.
That's amazing. And with the doula and midwifery coverages, I think, or I don't know if it was just doula for insurance. That's a state issue and not a federal. Like that's state issues.
Correct.
Okay.
In
So this
each
is strange.
very
What?
state,
Oh, go
go
ahead.
ahead. No, state per state, various legislatures have been taking up that issue. And, what you see is that, you have insurance companies, the same insurance companies across state lines, right? So you may have like Blue Cross Blue Shield of, you know, Virginia,
Right.
and the various health plans, association of health plans or lobbyists that may be working in one state to with the birth worker community or the maternal health community to codify in that state what insurance plans must cover. So for our state, we were focusing on Louisiana and what insurance plans in this state are actually required to cover.
Is that like only ones who are like actually located in Louisiana? So I'm not sure how, or is it anyone who lives in Louisiana and has insurance through there? Like I work for Humana from home. So my company is not technically in Louisiana, the headquarters. So is it for people who, and then sometimes, again, even if they work here, like if they just have a national insurance company, does it have to be something that has a headquarters? Or just if you live in the state of Louisiana, you have insurance here, then they're mandated to provide certain coverages?
Correct. It's going to be for the beneficiaries that live in that particular state. So, I mean, most insurance companies, a lot of them are going to have, national headquarters, and they're going to provide services in most states. Some of them with things like this, they'll already, cover it. It may be that, I know, like, for example, for Cigna, Cigna covers doula services reimbursement. I had Cigna at one point through my national employer, and they covered it, but all plans don't. So when you look at a measure like this, it would be requiring that plans who service people in Louisiana, they have to cover it. So it would be state specific, right? So
Oh, I'm sorry. I was gonna say when I had a doula, and I don't even know that I knew that I could check with my insurance to see if they covered it. Like I might have, I don't know. I guess I may have just assumed that it wasn't covered. So when you're saying this, that I mean, it just kind of, I was like, wow, like I don't even know, because my doula was expensive, but it was amazing and worth it to me every dime. But I just didn't even know to ask about that.
well, I'll tell you a secret. I didn't know either. So when I had Cigna, I didn't even know it was in my plan either. But honestly, wasn't searching for a doula. That was when I was pregnant with Levi. At that particular time, it wasn't something that was really on my radar like it is now or has been the past few years. So it wasn't something, but I was looking through. Yeah, it was Levi. Looking through my plan after I had Zoe, and I was like, "Oh, look at this! I didn't even know doula coverage was part of this." So I didn't know at the time either. So it is always good to check your plan, especially the maternity benefits portion, of the insurance plan. If it's one that is fortunate to have insurance, some people are not.
Right.
Yeah, I didn't know that. Didn't know that either. So
Yeah, well, thank you so much for sharing that. And then, what are some of your future goals?
So some of my future goals would be got a few, but I'll just keep it short and simple. Just really looking at truly launching my community education piece, of my business. I would say that I've truly launched because we provided some really great educational sessions. Now that it was launched at a time during COVID, that is. So now that we are moving to a phase where eventually we'll be able to move about society the way that we're accustomed to. Definitely would like to be more out in the community, to be able to have in-person interactions more with people, especially with conversations like this. And I'm actually planning some over the summer that will be in person in the southeastern and southwestern part of the state. Wanting to, bring on, some folks, with this business, so it's not primarily just me. That would be another great thing, to have truly the support that's needed to really grow this agency, to continue to do more impactful work in our community and our state. Ultimately, would definitely like to follow the blueprint that I was following when I was working with March of Dimes, where I had multi-state territory, especially as it relates to advocacy services, knowing that the health statistics are very dismal in our southern states and also coincides with some of the most conservative legislatures that aren't really enacting policies that they should, that really positively impact people, especially people who look like me. So not wanting to let go of those territories that I really, really enjoyed being able to be a part of, those teams with that voice of what's right, what should be happening, and really making sure that communities are afforded what we need, especially communities of color, Black communities, to be healthy and thrive, and just challenging, the status quo, and just really wanting to dismantle structural barriers that are very, very very rigid and baked into our societies all over, but especially Southeast, where we have some of the worst health indicators. So wanting to expand, eventually start back providing services in Mississippi, Alabama, Tennessee, Georgia, Carolinas, Florida, those areas. So I would say that would be my long-term goal in terms of my lobbying portion of my firm and my advocacy piece. And that would just simply be following the blueprint or the footprint of the services and my activity where I was responsible for that territory with an amazing group of colleagues when I was working as a full-time staff person at March of Dimes.
I love it. I love it. I love it. So as we're wrapping up, which this has been just such a rich conversation and so much information you've shared, I'll end with two things. The first one is, or end with two questions. Who inspires you?
My family inspires me. My kids, my husband, my mom, my sisters, my brothers, my family overall. When I look at some of the things that my family, my mom in particular, has gone through, the things she's overcome, just some of the stories that she's told me, in life about overcoming and being resilient, it inspires me to want to do better, to want to make her proud, to want to be able to achieve things that she could not because of societal limitations, things that we would have liked to see my grandmother be able to achieve, but again, could not because of societal limitations and racism and mistreatment and just so many things. They inspire me. My kids inspire me. They are resilient and they are just so amazing and bright. So my family overall inspires me in everything that they offer and everything that they represent. So
I love it. And then lastly, what would you leave to Black or brown families or any family who is a birthing family, whether they have, in any phase, whether they have experienced, anything or not, or they could potentially experience something, or just how to prepare themselves? What are some things that they can do now to that's kind of, I don't know if there's too much, just whatever you could share to kind of encourage them and leave them with some resources or tips or things they could do to protect themselves and to be prepared for what comes with pregnancy and birthing and all of that.
Absolutely. I would start off by saying that I know that a lot of pregnancies are not planned, meaning it's best to think of what you should be doing in terms of health before you get pregnant, right? Because I think it's over, I don't know if it's like 55%, 60, I don't remember the actual statistic, but a large amount of pregnancies are unplanned. So what happens is, people find out they're pregnant and then it's like the go button starts there, but the go button starts long before then. The go button starts like when you're a child and when you're a teenager, when you're, of college age and prior to that. So I would say just making sure that we're making healthy choices, that we are recognizing our individual needs, finding ways to manage stress, recognizing and respecting the need for self-care and for rest, and just making sure that we're putting ourselves and taking care of our whole selves. Because yes, you can, because you must, when you get pregnant, start doing all the things, but we should really be doing all the things before and then continuing to do all the things and even better when we get pregnant and then after. I would say that that would be a number one tip. But then during pregnancy, I would say knowing and listening to your body, finding a great provider. If you're fortunate to be able to switch providers, if you're not satisfied with yours, don't think that the one that you have has to be the one that you keep. You can certainly shop around. I would say that after pregnancy, don't buy into what society is telling us we should be doing, like bounce back and get back to whatever you were doing. It is a time for rest and for figuring out your new self, your new life, your new relationships, because those things look different. And basically, put yourself first and take care of yourself, and don't buy into what everyone else expects of you. Then I would say that from a pregnancy, from a self and from a partner perspective, learning to advocate for yourself, understanding that if your physician says that you have a chronic illness that should be properly managed, believe it, do your own research, ask questions, get a doula if you can, and know that don't be surprised or don't assume that you can't, right? Reach out. There are people who provide services pro bono. I know that, really no is not in my vocabulary. So, I'm happy, to provide services and help if someone, would like support. I love what I do. So it's an honor and a pleasure for me to be able to help someone. So don't assume that that's not something attainable. Just reach out, right? Because a lot of times there are resources available and people are willing and wanting to help. So don't just assume. Also, I would say that from an advocacy perspective, again, ask questions. If your doctor says something you don't understand, don't just say and leave. Ask questions, write it down, go home and research it. Make sure your family knows what your doctor said, especially if it's a dangerous condition like high blood pressure, gestational diabetes, if left unmanaged, that is, and other health conditions. Make sure that your village of people, if you're fortunate to have a village of people, know about the sensitivity of your diagnosis so that they know what signs and symptoms to watch out for, and they can get you the help that you need if something goes wrong. And know your birthing options, right? So OBGYNs aren't the only people who can deliver babies. There is midwifery care, and it is accessible. So I would say know that if you have a lower risk pregnancy, what options are available to you, and make that decision for yourself.
Yeah, I think, and I apologize if you all see my eyes shifting. My puppy is over here doing something that have a new puppy. But anyway, so I'm trying not to jump up and go off the screen to him.
You're fine.
And so, but yeah, the services, I mean, everything that you've mentioned, I think is just so important. And again, like you said, just being able to acknowledge and be okay with a different form of pregnancy. My first child was in the hospital without a doula. I wanted to have a natural birth, ended up getting epidural at the end, had a natural healthy birth. I was okay with, I decided I wanted a natural birth, but I was going to be okay with whatever happened because I understand the unpredictable nature of pregnancy and birthing. And then with my daughter, I did have her at the birth center with a doula, with a midwife, and had her completely natural. And so I had two totally different experiences. I would totally recommend midwifery and doula services.
Absolutely.
And would not go back to the hospital unless I had to for critical pregnancy or birth. And my next, if the Lord allows me to remarry and have another baby, I would love to have a home a home birth. And so I'm sharing that just to sometimes, some things we just never heard people talk about it. We never even consider it. And I'm sharing these things so that, here you hear two people sharing, this information. So consider it if you're pregnant, and then after you have your baby, they do have, like you said, the in-home doula services that can come afterwards. They have lactation consultants. Please, please, please consider if you're having any difficulty with nursing, even if it's because you have to return to work, please consider talking with a lactation consultant, connecting with other mothers. There is a Baton Rouge Breastfeeding Support Group, which was amazing support to me during my pregnancy that helped. There's so many ways that people can try to, again, everyone's not going to be able to breastfeed. Understand, I'm not trying to diminish that and try to say that anything's wrong with it, but really trying everything you can, because sometimes in the Black community especially, we rely on family members, grandmothers, parents, or whatever for information, but things may have changed, they may have advanced things, and there may be things that we were not aware of. And so we want to make sure that yes, you can talk to them, but also reach out to other resources if you're struggling, to make sure that you've done everything you can, because all of these things can assist you in decreasing postpartum depression and allowing a connection and bonding with the child, attachment, having a healthy attachment with you and the child. And the best advice, and you mentioned it earlier, that I received after having my son was the mothers who told me, don't try to get anything done. Just sit down and nurse your child. And once they freed me from that, I was fine because it's so draining, so taxing on the body. And just like you said, learning the child, learning baby, just allowing myself to rest. That was the best thing ever. And so really, really embrace that, women. We are not super women. Black women, we do not have to feel like we're a superwoman. We have to do everything sometimes, especially after your body has endured so much. A birth is it's a trauma. It's so much happening to your body. You need to allow yourself to rest, and don't feel like superwoman because I did it in 6 weeks, I got back to work, or some people even go back to work less than that. It's not something to wear as a badge of honor. Let yourself rest. Let yourself rest. It's okay. Now, if you can't and you have to, that's a different story. But what I'm saying is, don't wear it as a badge of honor, to kind of diminish other women, or to make yourself feel like you had to do it. I think we have to give ourselves the permission and give each other permission in this world, and say you have permission to rest.
Yes.
To rest and take care of your family, your baby, love, and don't feel bad that your dishes aren't clean. And you, especially, sometimes if someone's newly married and they have a baby and they're like, I'm not being a good wife because I'm not doing a million things right now. No, you are doing a lot. And husbands or the father, if you're not married, whoever, or a mother, whatever the terms are in the household, have patience and grace for the person who may be tending to the baby, who birthed the baby, or who's the one primary caring for the baby if there was a surrogate or whatever it is. Just show love, grace, and mercy to one another. It is such
a narrative. We have to change that narrative because it's bad.
And for the dads too. I don't want to say, because the dads are going through a lot too, so I don't even want to leave them out, saying that they're not. Show grace to the fathers because they are too transitioning and impacting. You just did educational, we just had a webinar for fathers, PTSD and mental health, and information to the impact it has on the men. And so many times our conversations are geared towards the women, but pregnancy impacts the entire family.
Absolutely. And we have to show it grace for everyone. It's a transitional time for everyone. And it's just so involved. And I think the bottom line is, you touched upon some really great things. We just have to change the narrative, right? The narrative has gotten very restrictive, all these expectations we have on moms and dads, and we have to just own that as much as we can in our own power. One may not be able to have, much control over if they need their job and their job is threatening to fire them if they don't go back because they don't have adequate leave. Hopefully there's another job that one can go to, but we know that sometimes people are in a rock and a hard place. But for those of us who wear that badge of honor, oh, I'm back at work at 6 weeks, to each his own, but you do you, and the rest of us are going to do us. Because I fell into that trap before, that mindset, and was thinking, okay, I got to do this at this amount of time, and oh, I'm here and I'm doing this and I've lost weight, and that is just so like unfair narrative to push off on other people. And we really have to break that cycle, because it's really not healthy and it's really not normal. So yeah, we have to be better.
Journey. Our journey is our journey, and it's not to be compared. We're not to look at, well, this one did this and this one snapback, and I've been hearing this pregnancy snapback stuff, and it's great if you can, and yes, you feel wonderful, but being sensitive to the fact that that's not going to be everyone's story and journey.
Right.
And it can be very challenging when that's not, and they're listening to all these people. And if you're one that's not, then know that that's okay. Like, it's normal. Like, we all have our own journey. My weight fluctuated so much. There's so many different things, and I don't want to get on a tangent about all the different topics, but just be encouraged, show grace, and of course, reach out if you need any support and services from the Amandla group. And thank you so much, Ms. Frankie, for your time and just sharing with us today.
Thank you. Thank you for allowing me to share and to be here. It's certainly great to catch up, and it's great to share this. And again, so proud of you and everything that you're doing with Progress, with Portia, and with everything. So happy to be a part of your platform and see all the great work that you're doing, and looking forward to finding ways to work together in the future. I know we have a little project coming up, and part 2 of that, rather. So looking forward to that and whatever else lies ahead. But thank you so much.
Thank you. All right. Have a good one.
Bye.